this summer is a harbinger to where we're going. So, this is not a problem that's going to go away. It's totally unacceptable that we don't have basic data for knowing how many people are getting sick and how many people are dying. This has to be fixed.
We've been told in story after story that this past July and August were the hottest on Earth since record keeping began, but how has this extreme heat been impacting real people? Medical anthropologist Rose Jones argues that due to political and public health failures, we actually know very little. Medicine, she says, prides itself on being evidence-based, but when it comes to the heat, we're largely flying blind. Rose, it's great to see you. It's great to see you again. And I felt like your presentation in San Marcos as my first exposure to you and your work was tremendous. It was, in my opinion, kind of the message. Anybody going in concerned about climate, working in Texas right now, especially, is the message people needed to hear, and for many reasons. And we're going to kind of get into that by unpacking some of those key messages. But I thought, your opening was essentially, that the message that heat impacts everything, and not just, our every organ in our body, our mental health conditions, everything. And yet we collectively, as a data-driven society, really have no idea how it's doing that, because that information isn't being collected well or understood well. And I'm wondering, and I think the term you termed related to surveillance in the medical community, the term you used in a follow-up email was train wreck. So I'm wondering if you could kind of go over the problem of surveillance, first of all, so folks know, maybe exactly like the problem with extreme heat and the challenge of surveillance.
Sure. So there are major challenges with having a standardized approach to looking at heat-related mortality and morbidity. It varies from county to county, state to state, and again, at the federal level. So if you look at the numbers, depending on what study you're citing, the numbers, for example, for heat-related death, I believe last year were somewhere around 750, but other studies calculated as high as 10,000. Most experts in this field agree, yes, it's a problem that needs to be sorted and err on the side of the higher number for mortality. And by the way, this is excluding data from this summer, right? So one of the things that needs to, this is not riveting news to the medical community. They're aware of it for the most part. There have been some efforts very recently, so we're way behind the eight ball on this, to begin looking at these problems. So for example, in July, I believe, federal government issued data through a surveillance EMS data, so that's going to be hopefully more accurate, because we'll be using first responders data as they respond to calls specific for heat. Other issues are much more challenging. For example, we have this whole problem with prisoners and mortality and morbidity with heat. And those are not numbers that I have any confidence in. We're still waiting for some of the reports to come in. And in some cases, there is a complexity. In order to have a definitive diagnosis for heat-related death, for example, you need to take core body temperature, right? And so there's access issues for that needs to be worked out as well. And the other issue that is embedded in the whole surveillance and how do we monitor it, and what are the challenges, is that there is some information that we just don't know. And that's, again, another issue of us being really way behind the eight ball in climate change and climate health and environmental health in general. So
it's not that it can't be known, not that these are things that can't be known.
Historically, there just hasn't been funding for this type of research. There hasn't been training. I mean, the last data that I looked at for medical school in terms of offering coursework, it was anywhere from 6% of medical schools in the United States up to 24, some cited 50. But most of that data was collected through surveys on a voluntary optional basis. And more importantly, of the data that suggests that there's been an increase in offering courses on environmental health at medical school level, we know that, those are elective courses, and typically they're first year students, right? So there's a disconnect in terms of the training that we do, the medical knowledge, and then this dearth of data, right? Mm-hmm. So for example, a study was just an empirical study, valid, great study, was released a couple of weeks ago, and it showed that for women in their third trimester of pregnancy who had been exposed for 3 consecutive days of temperatures 95 degrees and above, there was a 27% increase of life-threatening labor complications, including, blood disorders and sepsis. So here's a case where, okay, we've got new knowledge. We didn't know that before. And so if you had a woman come in with, labor complications, you're not thinking that because you don't know, you haven't been trained, you haven't had that experience. We didn't have that data. So I've had several. I had a OB-GYN physician recently say to me, and that's just one example. There are lots of other ways in which heat is mitigating, in this case, pregnant persons. And I had an OB-GYN say to me, wow, how many cases did I miss? I just didn't know. And I think that that's, again, part of the story. So some of the work that's being done, and I'm not a statistician, that really does sort of fall within their domain, but there's some interesting work being done in terms of how we can use statistics to get a better handle on what mortality and morbidity looks like. It needs to be standardized. There needs to be training. And, for that, we need funding. So again, to recap, the problems with mortality and morbidity, and I might add as a side note, this is important because if you're not counting it accurately, you're not addressing it.
Right. I mean, that's the point of all this. Is if we don't understand what's going on, we can't improve conditions. Because what you're mentioning right now, like, I mean, we kind of started the conversation kind of counting the bodies, right? Thinking along those lines. But what you're saying is if we don't understand heat impact, then we can't protect people who, have an opportunity, to survive, in spite of exposure.
Because surveillance will lead to screening, right?
Yeah, right.
That's how it should be done. So in a nutshell, what we have with mortality, morbidity, heat related is we have a dearth of missing information, knowledge gaps. We have problems with training. It's just not being done. If you're not trained to do it, it's not on your radar. And then in addition to that, we have this whole hodgepodge way in which this data is currently being collected. So and as a related point, Greg, and I know you know this, I'll just point out that this is inherent. This is why we refer to climate change and climate crisis as a wicked problem. It's problems where we're not just going to have, let's start counting bodies like this, for example, right? It's much more complicated than that.
Yeah, and as you know, I mean, we've been writing here at Deceleration about Albert Garcia, and he's an unhoused neighbor of ours. We spent, my partner, Marisol Cortez, worked with a team of folks inside and outside of local government, volunteers and agencies for a year, to get him housed somewhere because he had all of these conditions that made him difficult, right, to the providing networks. He wasn't able to clean himself, right? He had disabilities, he had a drug addiction, all these things. He was elderly, just these different issues. And he ended up back on the street while making allegations of improper conduct by a caregiver. And in my opinion, because the agencies did not respond with any kind of enthusiasm or urgency, he died under a month, living under a bridge that I clocked at regularly 115 degrees. It was one of the hotter pockets of downtown San Antonio where he was visible and therefore felt safer as a disabled person. But the interesting thing, I just relate is, I just got off the call with a public information officer explaining to me how the medical examiner's office here works. So Albert has died. His best friend and camp buddy blames the heat. This person themselves says they had 2 cases of heat stroke that required EMS response. And yet Bexar County is still counting 0 cases of heat related deaths. And what I've learned is that the medical examiner's office, the medical examiner says they, as a scientist, as a researcher, as a medical professional, don't feel they have the enough data to determine that any case is related to heat. And so they may reference it in the autopsy reports, but like if a county commissioner calls up and says, what's going on with heat? They don't have the resources. That what they're still trying to get a forensic anthropologist to help them put bodies back together that are, falling apart in the heat and the humidity. So I don't know where the data is coming from, because everything that's passed along from the medical examiners up to the state doesn't have a heat signature on it. Essentially, that's what I'm trying to figure out. So that's probably no surprise to you to hear that.
It's no surprise to me. And, my response to that would be, this is unacceptable. We have to fix this. And, the context here is that, medicine prides itself on being evidence-based medicine. And that's true for many of the disorders and, issues that we address, but not for heat. That's not acceptable. We have to figure that out. Why? Not just because it's the right thing to do, and it's going to provide funding so that we can get more data and help people that need to be helped. But the other underlying thing, this is about to get worse, right? This summer is a harbinger to where we're going. So, this is not a problem that's going to go away. It's totally unacceptable that we don't have basic data for knowing how many people are getting sick and how many people are dying. This has to be fixed. That's my response to that.
Thank you.
Again, it's very complicated. It needs to be done at a high level. I mean, to me, this is something that you put together a task force of experts in the field that come from various disciplines. You pull some NSF money, some NIH money. This is a priority, and that, in my opinion, where public health needs to go for dealing with extreme heat.
Thank you. And so when you were talking about this higher end number, 10,000 deaths, a year are related to heat, right? Or heat related deaths. Why are you persuaded to the larger figure rather than the smaller figure?
Because I see where the holes are, right? You provided an example of an individual. I see that over and over and over again. And when you have a system that's not consistent, not standardized, that's not evidence-based. There's no empirical framework for that. So I can't have reliability. And then I will add that the higher level is really being used by statisticians to extrapolate, what should the death rate look like in the summer without these heat, right? And so it seems very reasonable to me. And again, I also have looked at the data, which suggests that this is affecting every system in the human body, right? So the other thing, this is even more complicated, we haven't talked about it, but the other aspect, there are very likely aspects of heat that are impacting health and contributing to death that we're not going to measure, that we're not even close to. So we're excluding all of that. So I think that it's reasonable, and especially if you look at the data in Europe, their mortality morbidity data, the way that they're calculating it,
right, much higher,
accurate. And so I look at that data and know that we can get there. And I also know that those numbers, I think last year they reported, not this year, that data still has not been released. I think there were 66,000 confirmed deaths. And disproportionately high, by the way, for women.
This was last summer, 2022.
Right. So anyway, I digress. But I think that
no, it's fine.
If we don't, this is a starting point, right? We cannot help people. We cannot distribute resources. We can't move into the community unless we know what the challenge is. And the good news is I think that there is some effort. As I mentioned, the EMS data. I know of one professor here locally who's working to look at ways in which to correlate ICD codes to ambient temperatures retrospectively. So we are moving in that direction, but it needs to be a lot faster.
Yeah, could you maybe say a few words about heat, how heat impacts the body mind, that we know, and also not just how heat plays upon the body and the mind, but also switches on certain kinds of illnesses that we, like you mentioned, we understand or are beginning to understand, some we clearly aren't there yet, but I think that's be interesting for folks.
The climate scientists talk about the Goldilocks effect, right? Which is, we know from biophysical data that the human body can't be too hot or too cold, hence the concept of Goldilocks, right? So what we know is that when that comfort zone is abridged because of heat, it affects the way that we think, psychological, it affects our moods, it affects our reproductive organs, it impacts I mean, literally everything, cardiovascular, pulmonary. I mean, there's solid data on this, right? And so, and it doesn't affect all of us equally. That's the real kicker here, in my opinion, which is heat affects us all, but it doesn't affect us all equally, right? So people who have underlying conditions, people who are living in elderly people who don't have resources, poverty, people of color are disproportionately impacted, as I suggested in as we saw in Europe. The data doesn't show in the U.S. that women are disproportionately impacted per se, but I think that it's because the data is faulty, quite frankly. So it affects every aspect of our body. And that means that we need to be looking at people in terms of, what is their age? What is their risk factor? What kind of medications are they on, right? What kind of living environments do they have? Those are not typically part of a screening that's done with a H&P. I recently interviewed a nurse, and she had been a bedside nurse in a hospital for 15 years. And during COVID had begun to do home care and continued to do that post-COVID. And I asked her at the beginning of this summer, I said, what are you seeing with your patients? Are you seeing any kind of heat related? And she said, I think that I am, but no, I don't have any support. I don't have any. I said, well, where did you have you ever had training on heat? And she said, yeah, when I was 16-year-old, I was a lifeguard at the YMCA. She went through nursing school and had and here she was trying to figure out what to do with her patients. And what she said to me was really, I think, the other aspect of what she said to me was, she said, this would not have been on my radar when I discharged people from the hospital. But when I went into their homes and saw, they have air conditioning, but they can't afford to use it, right? So those are the kind of questions that need to be part of a screening, right? And so when you have somebody who's had no training, which is the norm, and they're dealing with cases that they haven't seen that's affecting all of the organs of their body, their medication, right? That makes the problem even more wicked.
Yeah, I had a response. I started thinking about some of these issues a few years ago, and when we created our extreme heat guide at Deceleration, which we're going to have to update after this summer if we understand what the heck just hit us. But one of the things that I heard people talk about this summer that I had not heard public health folks and community folks talk about before was the need for the importance of nighttime temperatures and cooling down, because I think folks, especially the very young and the very old, are most susceptible, I think, to this. And the World Health Organization, I saw, has long been promoting, saying the body needs to be able to cool down to lower 70s, at least every couple of days, get a good chunk of hours to avoid some of these heat illness and potential heat death, organ failure. And I'd never seen that reported before. So we included that in our guide this year. And I think that, I just feel like the way people have been impacted in this heat, like, we have not even began to understand it, because again, I just talked to our neighbors and how they're surviving. And you mentioned, folks have AC, but they can't turn it on, or, we're actually being told, and I support the messaging in part, energy conservation, voluntarily dial your thermostat or turn your thermostat up during this strain on the grid, right? And they usually say around like 78. So if folks are turning their thermostat up to 78 and not cooling it after midnight or whenever the all clear siren goes off, that's kind of dangerous. I mean, how would you respond to that, or recommendation like that?
We know that more people die, it's kind of counterintuitive, at night from heat related than they do in the day. And most of that has to do with, as you mentioned, the cooling effect, especially with the effects of urban heat islands, right? And I think what you said to me that's most striking is the messaging, the sort of, turn your and even the public service messaging that we have, it's so generic that it almost is useless. I see, we tell people stay hydrated. When I talk to people, hey, what is that? I'm a medical anthropologist. I know what that looks like. It's not a one size fits all, right? So when I start talking to people about, what does that mean? Stay hydrated. I've had people say to me, well, I just increase, I have extra beer in the evening. Okay, that's counted, right? Because what people understand to stay hydrated is again very different than, it's not a one size fits all. The same is true, I think, with the messaging of lower your thermostat. And by the way, that may not be appropriate for all individuals depending on what their health risk is, correct? So I think it's another one of those issues where we don't have good data at the community level for knowing what needs are. And we definitely don't have good messaging for engaging in public health.
Mhm. Mhm. And I'm wondering if you have sort of there's so many places we can go with this, and I want to follow up with you soon. I know you have worked in the role of, the urban tree canopy and the cooling, contributions of our urban forests. We're in a protracted fight to save 100 trees in our central park in San Antonio. It's been a really interesting conversation, and I feel like our relationships with trees is going to radically change in the next decade, or it will need to, because we've overlooked what they really do for us and how important our relationship is, especially with rising heat. And I don't know if you want to say a word about that, but I'm really thinking in terms, you also mentioned One Health, paradigm, our relationship to all other species in the environment and all these things. We can't understand our health without understanding all these interrelationships. But I wonder if you have kind of like a prescription for what I think about cities, because I write a lot about San Antonio and I compare San Antonio to Phoenix and to other places, but could be city or county or state government, but somewhat maybe even, I don't want to, maybe low hanging fruit, but easy fixes or places to start to better prepare and protect our neighbors.
So I think that, the evidence is really clear that trees provide an enormous amount of benefit for everything from psychological to health in terms of heat, mitigating the urban heat, not just urban, but mitigating heat effects. And I think that you're right. I agree with you that the relationship that we have with trees is likely to change, that awareness is building. But I would caution, I'm not an urban forester, but I would caution that it's not just a question of planting a whole bunch of trees. They have to be very strategic. I mean, urban forestry is very complex, right? What species should we be planting? Who's going to care and water for these plants, or the trees rather, right? So oftentimes what I hear people say now is, oh, we're just going to plant, 1,000 trees. That's a start, but that cannot be an ad hoc decision. It has to be, it's complicated, right? And the other thing I'll say, so to finish that thought, I think that when you talk about trees, that's a positive trend. I think that there is, again, increased awareness of the benefits that trees bring, and they can be very adaptive for mitigating heat.
Even more so than tree planting campaigns is protecting existing mature trees, would you say?
I wouldn't, again, this is outside of my area of expertise,
sure.
But I would say that, some species are vulnerable to disease. We're seeing that in several states, including Texas right now. And so I think that you need an expert, you need urban foresters to look and see, can these trees be protected? And if so, what's the cost benefit ratio, right? But the other thing, to get back to your other point, that I think, as a medical anthropologist, that's really critical within this context is I'm seeing the emergence of a new paradigm. It's been around for 10 years, but it's gained popularity, called One Health. I think that's really critical because it seems like a nuance, but it's predicated on the idea that, the human health is related to soil health, related to animal health, related to atmosphere health. It's one health. We are a unified system. We just haven't approached it like that. I mean, indigenous communities did, Native Americans, that's inherent to their thought process and their worldview, and that got scattered and smashed. And so I think if there's any message in terms of trees and connection with health, that really does need to be at the forefront, this notion of revisioning how we engage with ourselves, other species, with this more holistic, integrative framework. I think that's very promising.
Mhm. And you'd mentioned at the presentation at your talk in San Marcos, and that some of the conversations you've had as a researcher, as an anthropologist, as a medical anthropologist, with folks in the medical community had been uh, mm, complicated by concerns of these individuals that, hey, don't put my name on that if you're talking about climate change and medicine and research. What, I mean, I can guess, but how did you understand, I mean, we're in a period where a lot of things are being legislated, and that's our bodies, right? And to start,
Women's bodies in particular, I might
what's
add.
that? Yeah.
Women's bodies in
Yes,
particular.
women's. Yes, absolutely. Yeah, absolutely. And so yeah, tell me a little bit about what you were hearing from these individuals, and what, if this is a trend. I mean, it's seems to be right around the country. Um, uh, what that may forebode in terms of public health and these colliding, we'll call them ecological crises.
It's very worrisome from my perspective, because what we are seeing, what I'm seeing, boots on the ground, is an inherent fear for some providers, others a concern, maybe more accurate, with publicly advocating for some of these agenda items that we've been talking about: surveillance, screening, more education and training. And the reason for that is, of course, as you alluded to, there's a political overtone that is breeding that fear. And you'll recall in my presentation that I used the analogy of what was happening with women's bodies. There were a couple of OB-GYN physicians from Louisiana that went on record publicly. I think 60 Minutes even carried it recently, that said, we have been told not to show data that provides information related to disparities within women of color. They also were on record as saying, there's fear from my colleagues. And so I use that as an analogy because I see that same fear and that same phenomenon playing out with some of my providers. And for example, I had a resident actually recently tell me, in Texas, she's doing ER was her rotation, and she was afraid to ask a woman, or if a woman approached her in the ER who had recently had an abortion, who had gone to another state, she was not happy about that and fearful, because she knew legally she needed to document that in the patient's chart, and then feared what would be the ramifications for her, right? Or her patient. So she told me, I just tell patients, don't tell me anything about that. I don't want to know. Is that medicine? Right. That's a political decision. And similarly, I was having this conversation exactly with a colleague in Houston, and she said, "Oh, well, we've rephrased the question when we meet with women. We don't ask them when their last menstrual cycle was. We ask them, are your periods regular?" That's a different question, a totally different question. One of which that can impact your ability as a provider to understand this woman's health conditions, right? And so I use this as an analogy, again, because I see the same phenomenon playing out. And think about what's happening. Texas is ground zero for equity and heat. We've had House Bill 2127. We've had the border issue with medics on record for withholding water, right? That's a basic human need. I mean, these are life-threatening conditions. So when you look at the culmination of those human rights issues, how could you expect a provider perhaps not to be fearful, or by contrast to assume a very vocal role in trying to bring change? And I will say that that was one of the reasons that I made the decision to leave the nonprofit that I was at, because
Mm-hmm.
I recognized that somebody had to go and have these conversations publicly. And I
Mm-hmm.
recognized that, that was not going to happen with my physicians, for example. They have tenure, they've got debts to pay off, they have careers and children to take care of. I don't blame them, right? I blame the system. So
Mm-hmm.
I think that again, these are conversations that we need to have. It's a real fear and a real concern, and just another layer for what we're dealing with in terms of the complexity of and its impact on human health.
The complexity of, you cut out for just a second, the complexity of,
Climate crisis and
yeah,
health. Yeah.
yeah,
So what you and I have been talking about is we've got these, data problems, significant on their own. We've
yeah.
got fear from our providers, significant on their own. And then we've got in
Mm-hmm.
between, we've got dying and sick people that
Mm-hmm.
we need to help. And
Mm-hmm.
so yeah, so that's what I think. And it just has not been, you haven't asked me this question, I just maybe digress a little bit, but
Bring it in.
along those lines, within that context, one of the things, and that's one of the reasons I was, eager and happy to speak with you, is that if I look at what happened with media this summer
Mm-hmm.
and heat, for the most part, the stories were hypersensation with regard to temperatures, right?
Mm-hmm.
In this record, July is the hottest, right?
Right.
And we are a culture, at the risk of being stereotypical, that focuses on extremes, right?
Mm-hmm. Mm-hmm.
That was not the right message that needed to become.
Mm-hmm.
That was not the important message per se, right?
Mm-hmm. Mm-hmm.
And yet, if you look at the stories that were being covered, it was by and large, look how hot it is. It's getting hotter. What does that mean? There,
Yeah.
and so it's really interesting. I was really happy to see you want to take a deeper dive, right?
Mm-hmm.
We saw some of this, but for the most part, the media stayed with these stories. And the
Mm-hmm.
other thing related to that is I've had several press reach out to me and say to me, I get what you're saying, Rose. I think it's important, but my editor doesn't think it's a connection. My editor is telling me it's hot, get over it. That's
Wow.
another, so that's
Yeah.
really disconcerting, right? So I
I
know
I had read in the middle of this summer, some commentary about, how adaptable humans are, and that includes psychologically to new extremes, right? They become normalized and internalized and digested. And it is true that I haven't seen, we've been talking about Albert. We've had a vigil and then in two actions outside the offices of some of these agencies to draw attention to his case, because, whether, and I doubt we will ever see in autopsy, it sounds like it's impossible under the current medical examiner and that regime that we have right now, that we'll see this listed as a heat-related death, even though, those who lived with him, he died at night, and he was a drug user and they did use drugs that morning, but he died in the night, quietly, at a very, very hot location under the highway. Um, and even without official documentation, we can talk about what the experience is for people who live in those, exposed in those conditions. We can talk about and need to be talking about those who are most vulnerable, and those, whether it's the legacies of redlining or the current kind of like I call it kind of like a climate apartheid, where we're putting in investing in areas for certain people and not for others and things like that. But I wonder, maybe if there's sort of like and so I guess what I was going to say related to media, I'm not seeing many people writing about what the hell just happened, right? To understand the summer in context outside of what you're describing, which is how hot was it? Did it meet this? Was it that many days? How many days was it? And it feels like kind of like, I mean, I lived through the heat our main house, we couldn't get it cooler than 85 during the day. I could close off a bedroom at night and get, but I did notice my psychology, my life changed based upon kind of like that background just irritation. And so, yeah, trying to understand what the heck just happened and how are we going to be ready next time. It feels like people are just ready to get outside and party, kind of like a post-COVID wave or a after the winter storm, or
think I think that there's a media inertia. That's how I would describe it. And it's intriguing to me to hear young journalists who very much are interested in the space of climate crisis talk about editors not thinking that this is a useful utility topic, right? That's an issue in itself. The other attenuating issue that I might throw in here, Greg, is that in addition to not covering the story, I'm also not seeing dots being connected. And when you're talking about wicked problems such as heat and climate crisis, you're talking about multiple dots that need to be connected, silos that need to be broken down, institutional barriers, all of that. But here's a perfect example of shocking to me that the media is not on top of this more than they are. So we know that there's a problem in Texas prisons with heat. We know that we've got higher death rates, some of which, because of the data and all the politics associated with it, are still being determined. But the penal system in Texas is on record for saying, yes, we've got higher heat-related, higher mortality in general, whatever we contributed to that, higher homicide rates, right? And then they closed down all of the prisons 2 weeks ago, right? Attributed it solely to drugs. And by the way, would it surprise me that there was increased drug use or increased violence in the cells? I mean, we're getting temperatures anywhere from 120 degrees and up. And by the way, that's not being objectively assessed, right? But we all agree. So think about that. Those dots are not being connected. I didn't see one challenge in any of the media. Hey, what's accounting for that? It was like, oh, the prisoners are being bad. Their drug use is out of control. We're shutting down the whole system. Those dots need to be connected.
Yeah, and I think that's part of the conversation I want to have going forward. And I do want to I'm gonna step out here, but let's follow up on that point, because that's one of the stories that I want to pick up with you. And there's a lot to cover and a lot to do, and hopefully we'll be able to expand the space to make some of those connections looking back over the summer. And appreciate you and your work so much, and I'm interested in learning more, perhaps another call, about what the work you're moving into, kind of like as an independent consultant nonprofit, sounds like.
Yeah, that's the plan.
All right, thank you so much, Rose, and I'll be in touch very soon.
Take care.
All right, thank you. Bye-bye. Thanks for joining us at Deceleration. We're online at deceleration.news. These podcasts come out somewhat irregularly, but you can find us online any day, anytime. We appreciate any story ideas or tips. You can email us at editor@deceleration.news. Appreciation still out there for George Garza Jr. for this theme music. We will be continuing to follow extreme heat, its impact, and how we can best keep each other safe. Take care.